Good question. So for head and neck cancer in general, it's a very toxic treatment that's typically treated with radiation plus or minus chemotherapy, plus or minus monoclonal antibody therapy. The goal of treatment is, of course, to eradicate all the disease that's visible, but also, in addition to that, you want to limit the toxicity, most importantly to the esophagus, but also to the surrounding skin and the salivary glands. And this can be accomplished in a number of ways. In terms of radiation, you want to make sure that you are properly avoiding these areas with the proper technology. Well, if it's localized to a primary site, such as the tonsil or the base of the tongue, there are scenarios where you can get away with just delivering radiation to that location. But once it starts spreading to lymph nodes, then you have to target not just those lymph nodes, but other potential lymph nodes that may be involved. And sometimes they might cross over onto the opposite side of the neck, in which case you have to radiate a much larger area. Proton therapy can potentially. What it can do is it can diminish the amount of radiation administered to the skin. So the skin might receive a little bit less radiation utilizing protons, although that advantage is not usually substantial. Protons can also shape the radiation around the salivary glands a little better as well, and shape it around concave or convex structures, such as the trachea or the spinal cord as well. I will say that the advantage of protons are relatively limited in this setting. It can, although the jury is still out a little bit on that. Some people report anecdotally, without the highest quality of data, that the skin and the soft tissue can get less radiation dose and you can get less fibrosis, although that's never really been realized in long-term clinical studies. The availability is relatively limited. There's only a handful of proton centers throughout the country. And quite frankly, existing technology with IMRT, with the existing type of IMRT that we have today, tends to be roughly similar in outcome to protons. I think the technology has evolved quite a bit, and protons might have some advantage, but a lot of those advantages are mitigated by the quality of IMRT machinery that we have nowadays.